this is Robin from Hospice Maui. Just wanted to let you know that generally when people come onto hospice, they don't want to go to the hospital anymore, they don't want to go to the emergency room anymore, they don't want any more treatment, they just want to stay home and be comfortable. Our nurses are on call 24/7, so even if something happens at 2 in the morning, you call us. If we can work it out over the phone, we do. Otherwise, we will come out to the home. Hospice is an insurance benefit, so whether you have Medicare, HMSA, Kaiser, it's covered under your insurance. You should not get a bill for anything. Included in our service is the staff. We have a nurse that will come to your house, usually starting twice a week, just to do an assessment, make sure you're comfortable, make any recommendations to the doctor. An aide who will do personal care, can give you a shower, bed bath, wash your hair, cut your nails, massage your feet, that kind of thing. And then we have a social worker that deals with things that are financial, insurance, emotional support, and that would be your team, your nurse, your aide, and your social worker. Unless they're on vacation or sick, you'll see the same people. And then in addition, we have volunteers. The volunteers can come in one of two ways. One is if you have an appointment in a few weeks and you need someone to stay with your loved one. And the other is sometimes the volunteers can come a couple times a week just to sit with the patient and while the caregivers can take time for themselves. It's very important for the caregivers to take time for themselves. And then we have the equipment, whether you need a hospital bed, wheelchair, walker, bedside commode, oxygen, any equipment we order, and we try to have it there if you're in the hospital, or if any other setting, we try to have it in the home before you're there to make you comfortable. And then supplies, we just ask the patient or the family before you buy anything for the patient that you call us and ask us and see if we have it, and if we do, we'll bring it. And the medications that are related to the hospice diagnosis, we order through our pharmacy and they're delivered to the door by FedEx. We just try to keep everything simple and at home, and our services are customized to your needs, as little as much as you want. So everything is for your comfort. And in addition, just wanted to let you know that coming on hospice doesn't necessarily mean you're going to die. Some people do die in our service, and we try to make that as beautiful and as pleasant for the patient and family as possible. But some people decide they want treatment in a few months, and they do. You can just go off hospice if that's the case. And sometimes people get better and they don't decline anymore. And if you do not show any decline, then you can go off hospice services, and if it comes to the time where you're declining again, then you can come back on. Okay, thank you for listening. Aloha.